Hey guys, Tierra here with Doc Girl Fitness, and today's video is all about my progress after my most recent hip surgery. Welcome back to the channel, guys. For those of you who don't know, I'm Dr. Tierra Range, a current third-year pediatrics resident physician who makes videos about medicine, lifestyle, and fitness. If that sounds like something you may enjoy, please make sure to subscribe to my channel and hit the notification bell so you never miss another video. Thank you guys so much for your patience in me getting this video out to you. It was actually supposed to be posted last week, but the reason why it wasn't was because I got the flu and I lost my voice. I tried so many times to film this video and you really could not understand anything I was saying because I was coughing every few seconds and my voice was completely shot. So I wanted to wait until my voice had fully recovered. And so thank you so much for waiting for this because I'm so excited to dive in and let you guys know how everything has been since we last chatted about these hip surgeries. So if you are tuning into the channel for the first time, I recommend that you click the link above, which will take you to the playlist of videos that really chronicles my entire journey with being diagnosed with hip dysplasia and going through the process of having these surgeries. To give a quick synopsis, I was diagnosed with hip dysplasia in my first year of pediatrics residency, very soon into starting residency, and the options that I had to manage my symptoms and to deal with this hip dysplasia were to either have a surgery in a couple of months from finding out that I was diagnosed, that's called a hip preservation surgery, and to move forward with that immediately, or to wait a couple of years, continue with the same symptoms, but wait till I get done with residency, but probably at that point I would require a hip replacement in both of my hips. I chose the former and got the hip preservation surgery, which is also known as the periacetabular osteotomy. After having my periacetabular osteotomy almost 2 years ago to the day, I had the surgery November 4th of 2020, and here we are in 2022. After my first hip surgery, I really was just not recovering very well. I was still requiring assistance with the use of a crutch almost a year post-operatively, and I was having a significant amount of pain. Re-imaging revealed that several of the screws in my hip had broken and my bones were not healing very well. This is a very uncommon complication of the surgery that I had, and my surgeon is not entirely sure why it happened, but I really do appreciate how proactive he was in getting me back in the OR and trying to correct the problems that I've been having since that first hip surgery. So in December of 2021, I had an osteotomy repair, and that involved getting the screws that were broken out of my hip, as well as the other 2 screws out of my hip, and replacing them with 4 larger titanium screws, and also bone grafting the area that was not healing. My progress after that most recent hip surgery has been better than my wildest dreams, and that is genuinely no exaggeration. I had the surgery 3 months prior to my wedding, and I was actually very nervous about that because I was still using a single crutch up to a year after my first hip surgery. I'd already bought everything for the wedding. Everything was already paid for and non-refundable, including a honeymoon that we booked to Banff with the only plans in mind to hike the entire honeymoon. So I was really nervous going into the second surgery, wondering how everything would work out. And I was very transparent with my pediatric orthopedic surgeon about my apprehensions. And he said, look, I really think that this surgery is going to do the trick, and we're going to do everything that we can to hopefully get you to a point to where you're not even using assistance by the time of your wedding. And if you do have to take it on the honeymoon, it will be for very limited time periods. I was done using any type of assistance by 12 weeks post-op, which was shocking to me because I'd had so many complications after my first hip surgery. I just could not believe how quickly I advanced in my progress and in my mobility just 12 weeks post-op. I was no longer using the crutch, and by my wedding, which was about 14 weeks post-op, I used 0 assistance. I also ended up not even taking any kind of support with me to the honeymoon, and I was hiking in the mountains several miles a day every day. Also, I want to be clear that everything that I did post-operatively was only after I had been cleared both by my pediatric orthopedic surgeon and by my physical therapist. And that is something that I would recommend anybody who is having any type of procedure do as well. After I came back from my honeymoon, I continued to do very well post-operatively, and to this day, I'm still doing very, very well. Now 11 months post-op from my most recent hip surgery and 2 years post-op from my very first hip surgery. My most recent visit with my pediatric orthopedic surgeon was last August, and so what I'll do now is I'll include a picture of the most recent x-ray that I had done, and I'll just do a voiceover and we can chat about what we're looking at. So what we can see here is that I had my left hip surgery, and you can see that there's 4 screws here, and there are 2 little fragments of screws. Those fragments are from my prior hip surgery. During my first hip surgery, as I mentioned, 2 of the 4 screws broke, and in the process of trying to remove them during my second hip surgery, 2 fragments were unable to be removed because the bone had healed around those bone fragments. According to my orthopedic surgeon, there is no concern as to whether or not that's going to cause any issues down the line, and there are many people who have this surgery and keep all of their screws in forever. So I'm just aware that they are there, and it's something that I make sure to mention to people, and if I were to ever see another doctor, I make sure to let them know I have screws in my hip as well as 2 screw fragments from a prior hip surgery. It's kind of hard to explain what else you see here, but basically what we're looking at is that the bone is entirely healed where it needs to be healed and where the bone grafts were placed. There are parts of the bone that are not healed, and those parts are the parts that will never heal. As I mentioned, my pediatric orthopedic surgeon is still not entirely sure why there were parts of my bone that didn't heal after my first hip surgery, but those parts are parts that are so far down into the area of my pelvis that it is nearly impossible to reach again without doing some major openings of the lower half of my body that are completely unnecessary, especially because the parts that are required to be healed to allow for me to have full mobility with no pain have completely healed. So what we're looking at is the parts of the bone that needed to be healed have fully healed. And so this is a successful revision to the initial surgery that I had, and I'm doing so much better. As I mentioned, that appointment with my orthopedic surgeon was in August of this year, and I'm doing so well physically in my symptoms as well as through my imaging that the pediatric orthopedic surgeon has let me know he doesn't need to see me again until May, which is so wild to me because, guys, I was in his office every other month for the first year post-op because I was having so many issues. So to be at this point in my recovery where I'm progressing so well that I can really space out those appointments is just, it's such a blessing, and I'm just so thankful that I've really reached this part of my progress. There are a lot of things that I feel like are contributing to why things have gone so much better this time around. Of course, first and foremost, I would say because of how well things went in the operating room. But outside of the operating room, I've really made it a point to address things that he really made sure that I addressed. For example, vitamin D supplementation. And this is something that was a plan with my orthopedic surgeon, and I would not do anything or adjust anything about your management plan unless cleared by and recommended by your treatment team. But for my treatment team, having vitamin D supplementation on board was really important, as well as being very consistent with my physical therapy, both in the physical therapist's office as well as at home, doing the exercises that were recommended that I do at home. I made it a point to do that all the time, and I'm still doing that all the time. I still am going to the physical therapist's office, and I feel like all of that has really made a difference in my progress as well. As it relates to physical therapy and my clearance, I have officially been cleared to do walking and to walk up and down stairs, but I am not cleared yet to run. I say yet because that is something that we're currently working on in physical therapy right now. The main reason why I have not been cleared yet to run through discussion with my physical therapist is because of how many complications I had after my first hip surgery. My entire treatment team is very aware of all the problems that I had, and in an effort to continue to allow me to progress without setbacks, everybody is being a lot more cautious with me about how I advance in my mobility. I actually am so appreciative of that. I feel like everybody has been so supportive and has really tailored my care to me and my specific issues. But what I am allowed to do in terms of walking is not really limited. I walk a lot. I am, as I mentioned, a pediatric resident physician, and I work about 80 hours a week, so I'm walking a lot at work. In addition to walking a lot at work, there are several days out of the week where when I'm not at work, I will go to the park and I will walk, in addition to that, 3 to 6 miles. A lot of you ask about my pain level and if I am still having any pain, and the answer to that question is no, I'm not. I don't have pain. On a regular basis, I would say my pain level is a 0 out of 10, and that's with walking around the hospital and staying really active, and then also being active outside of work. Every now and then I will have a couple of aches in my muscles on my left side, and I attribute that to sometimes doing a little bit too much. There were times when I was initially given the okay to advance in my mobility that I would do everything in one day. I would go to work and I'd work a full 13 or 14 hour shift, or I would actually go on a call shift and work a full 24 hours. Then I'd leave the call shift and I'd go to the park and I'd walk 6 miles, and then I'd come home and try to do hip exercises. Why I was doing all of that, I really don't know. I think I just get so excited sometimes because I've been having such a limited mobility for the past couple of years. And prior to that, y'all, I was super active. So sometimes I just get that itch to get back out there and do everything imaginable. And sometimes I was doing too much. And in those situations, I was definitely not completely incapacitated and unable to do anything afterwards, but I definitely did have aches and pains in the muscle surrounding my left hip. And I feel like that was my body's way of letting me know I had done way too much. In terms of whether or not I require medication to not feel any pain, the answer to that is no. And I actually am not even allowed to use medication to treat my pain. And I'll explain why. So as I mentioned, my most recent hip surgery was about 3 months prior to my wedding. And I was working tons of hours. I was trying to plan a wedding, and I was really anxious about not only the wedding, but also the honeymoon, because as I mentioned, our honeymoon was in Banff. It was absolutely beautiful, but that trip was booked prior to recognizing that I was gonna need a second hip surgery. And I don't think I ever would have planned a trip to the mountains where I would be hiking every day if I would have known I was going to have a hip surgery 3 months prior to leaving for my honeymoon. In anticipation of these big life events, I started taking naproxen pretty much around the clock based off of the guidelines on the back of the bottle. I was taking it like every 4 to 6 hours every day leading up to my wedding. And I think I was mostly doing that because I had had so many issues with pain with my first hip surgery. And so I was anticipating that I would have the same kinds of pains after my second one. And I needed to stay focused, and I had all of these things going on. So I was just trying to get ahead of what could potentially be an issue for me. And long story short, I started having severe abdominal pain. I actually had to come back early from my honeymoon, not because of mobility issues, but because of my stomach pain. I ended up in the ER, and long story short, I got referred to a gastroenterologist who had to do an EGD and a colonoscopy on me, which is very ironic given my interests within pediatrics. And for those of you who don't know what I'm referring to, click one of the links above to see one of my most recent videos. But what my gastroenterologist found in my scopes was that I had a lot of stomach ulcers. And the thought is that I had those secondary to overuse of NSAIDs. NSAIDs stands for non-steroidal anti-inflammatory drugs, and naproxen is an NSAID. Overuse of any medication is a problem, and one of the side effects of overuse of NSAIDs is increased inflammation of the stomach lining, and it can sometimes lead to stomach ulcers. I would say that's the only complication I've had post-operatively, and it's nothing as it relates to my hip. And it's only due to me being apprehensive and anxious about having pain and trying to preemptively get on top of that by taking the naproxen. It was honestly the biggest blessing to be told I couldn't take the medication anymore, because it made me realize I was not having pain. I have not had any hip pain. I haven't used any kind of naproxen, any kind of NSAID, any kind of medication to assist in pain alleviation in several months. And I have not had any issues with pain, a 0 out of 10 pain level. So it just goes to show that I was very anxious about the idea of pain, not realizing that I had no reason to be anxious about that this time around. I think I could be having a lot of improvement in my symptoms also as a result of this entire fiasco, because I've had to change my diet a lot because of these stomach ulcers. And I've had to change to foods that are more bland and soothing to the stomach lining because of how inflamed the area has been. This has led to about a 15-pound weight loss. And in the process of weight loss and getting a little bit more pressure off of my hips, I think that also is contributing to why I've been feeling so well. As we move on to me talking about food, I want to mention that something I am so excited about now that I have increased mobility is getting back on track with my health and fitness journey. I'm so excited to put the fitness back into Doc Girl Fitness because I definitely had to take a pause there for a couple of years. One way that I feel a lot of people cope, myself included, is through soothing with food, and that has definitely led to a lot of the weight gain that I had after both of my hip surgeries. Getting off some of that weight that I gained in the process of finding out about this side complication that I've had has really opened my eyes, not only to the fact that I really need to take back charge of my health and fitness journey, but also I want to continue to be my best self, and I can't unless I continue to pour all parts of myself into this journey. And a healthy lifestyle is a part of that. I'm so excited to take you guys on that part of the journey, and more videos are to come for how I am increasing my mobility, both through my exercise journey as well as some of the dietary changes I've already made and those that I continue to plan to make in the coming future. In terms of exercises, what I'll do now is include some clips of myself at physical therapy so you can see some of the different things that I'm doing in physical therapy to help with my mobility. In addition to these exercises, as I mentioned, I also walk a lot, and that is something I plan to continue to capitalize on as my physical therapist and I work together to get to the point of being able to run. Last but not least, one of the biggest things I feel like helped me get to this point of increased mobility and just being able to do more is having the support. The village that I've had has truly made such a difference for me, and I can't thank everybody enough. From my husband to my parents to my extended family, my friends, and also importantly enough, you guys. Having your support, the kind messages that you guys have been sending me through direct messenger, emails, Facebook, as well as the comments that you leave on my posts, it just continues to remind me that we're such a big community, and I hope that I can be of support to you guys in the same way that you all have truly supported me throughout this entire process, and I genuinely cannot thank you guys enough. One way that I feel I have been really supported from you guys is through us coming together with #HIPHIPHOORAY. For those of you who don't know, I created a merch line called #HIPHIPHOORAY. For those of us who are recovering from hip-related issues, as well as everybody who has supported all of us through that journey. If you look at the design for #HIPHIPHOORAY, it's really meant to cater to both of those groups of people. In the design, you'll see that there is a circle with a crescent around it, which some people will mistake for a moon and a crescent moon, but actually what it's meant to look like is a hip joint. So for those of you who are interested in supporting the journey and feeling like you have that community while you wear clothes, but you don't want to make hip dysplasia or whatever hip condition you have your entire identity, wearing this allows you to do both at the same time. In hashtag HIPHIPHOORAY, what we believe is that regardless of what we're going through, we're one step closer to getting to increased mobility, feeling better, and getting back to the best version of ourselves, whatever that looks like after one of these big diagnoses. I really encourage you guys to check out the website. I'm actually wearing one of the more understated designs right now in this sweatshirt. It's so comfortable. I'm sure you noticed in my physical therapy video, I was wearing another one of the designs. But in addition to clothes, there's also other things you can wear, from hats to pins to bag clips, stickers. There's even water bottles. And also something that I think would be so helpful and such a sweet gift to somebody who's going through this hip journey. We have little teddy bears that you can give to people when they go to the hospital for a surgery, or whenever you see them and they're in the recovery at home and they need some kind of fuzzy and sweet gift to remind them that they're not alone and we're all in this together and we're all supporting each other through this journey. It would mean so much to me if you guys checked out the website and considered getting something. If you do end up getting something, please let me know and send me whatever pictures or videos that you have. I'll actually include a clip here of one of the sweetest PAO warriors. Her name is Claire, and she has a lovely Instagram channel. I'll include some screenshots here. But she wore one of her hashtag HIPHIPHOORAY videos during her most recent hip surgery, and it just gave me so much joy to know that we're all coming together from all parts of not only the country but the world to show our support for each other while we go through our journeys. If you end up wearing some hashtag HIPHIPHOORAY merch, let me know. Send me some pictures or some clips and I'll make sure to highlight it on my social media accounts. And links to all of those accounts, as well as some of the things that I've highlighted in this video, will be found below. To wrap up, guys, once again, I just want to thank you guys so much for being with me throughout this journey. Continue to ask me questions. If there's anything specifically you want to know about, let me know. But I just wanted to let you guys know that at least on my side of this journey, as somebody who's had complications, there really was a light at the end of the tunnel, and I am back to being my normal self. I am back to the happy and confident and hopeful person through God's grace that is here to encourage you through every step of the way. And I can't thank you guys enough for being here with me throughout it all. But that's pretty much it, guys. That's everything I have to say, at least at this point, about how my progress has been after my most recent hip surgery. I am so excited that you guys have been willing to follow me along in this journey, and we're still in this together. Make sure to tune in next week, as next week's video is actually going to be a medicine related video, giving some gift ideas as we head into another really big medical career milestone. As always, if you liked this video, make sure to give it a big thumbs up. If you have any questions or you just want to chat, make sure to let me know in the comment section below. And if you like videos about medicine, lifestyle, and fitness, then make sure to subscribe to my channel. I'll see you next time.